Hi guys, here we are in your knee. We are looking up at your kneecap and it looks totally normal. That's good. Down here at the groove where your kneecap tracks, that looks totally normal even as we bend it. That's all great. Now look back up there and your kneecap sits down in the groove pretty nicely. Little bit of tilt, but not bad. Medial gutter part of your knee is normal. Down here into the medial compartment. So end of the femur looks great. Remember, you bruised your bone out here. Don't see any damage to the cartilage anywhere. Meniscus is in the middle. At first glance, that looks totally normal. Center of your knee. ACL has torn off the femur, kind of scarred to the side. When we pull on it, it's not hooked on anymore. See how much it moves? So, stretched and torn. And up there at the top, it's kind of not hooked on where it's supposed to be. Then we come to the outside of your knee. When we examined you, all the stuff you did out here has healed pretty darn well. So that's a good thing. And at first glance here at your lateral meniscus, that looks normal. And femur above, pretty normal. Shin below. Back of your knee, pretty normal. All right, pretty good. So that's a good start. Not a lot of other damage. We know you did the lateral collateral, which is, I guess I should do that, shouldn't I? Lateral collateral and all that other stuff that has healed in pretty well. Here's my needle coming into your knee. And there it is, and there's where your ACL is supposed to be inserting up back there, and you can see, I'll show you in a second how loose it is when I probe it, but that ought to work pretty good for height, I think. Dilating probe coming in now. It's about the size of a ballpoint pen. Gives you an idea of how magnified everything is. And look at your ACL. See how we kind of bend it around there? Here's the regular probe now. And you can see there's a chunk of your ACL that's kind of hanging down back there in the back. It's just all loose. You see how it's all folded on itself? And when we push on it, your ACL goes real loose. See that? So it's not functioning very well, like when I pulled on your shin and showed you that. Drop the bed some, please. So here is your lateral meniscus. That's good. There's your popliteus tendon back there, and I really want to look at that carefully. So the back of your meniscus is fine, and with your knee in extension here, when I pull on your tendon, it's tightening well. See that right there? That's nice and tight. So that's good. So, and that looks pretty good. Pretty normal there. So, let me just flip this off for 1 second. I'll flip it back on in a second. And I will talk to him. Okay, so that tendon back there is good. The meniscus here is fine. Underneath, maybe you had a little kink there, but nothing huge. So I think that looks great. End of the femur, fine. Top of the shin, fine. So I'm going to flip this off, and then I'll show you the medial side in just a second. All right, probe please. So here's your medial side. Maybe. So there's your meniscus. on the medial side. There I'm over the top of it, way back there in the back. Sorry for the blood. So your meniscus there. There was some suggestion you might have had an injury there, and you didn't. I'm feeling underneath it now, and that's all fine. So that's great. So now we're going to come to the center of your knee and start to work on your notch. So what we do is here's our shaving tool. First thing we're going to do is take this little band of tissue out. But what we do now is we make this notch just a little bit bigger. And we're going to go back and forth here with this shaving tool and make your notch just a little bit bigger. Your notch is definitely a little small. The space from here to there is a little small. So we're going to make that a little bigger. We'll come in and out of the portal here a little bit, eat a little fat on the portal. Makes it easier to pass our screw for later. All right, so then we come in here and we make this space for your new ACL a little larger. So this takes us a while, but we're going to come in here and clean away a little bone and cartilage and a little tissue to make sure that your new ACL doesn't hit the wall here. So there's not a lot to see here because we just kind of go back and forth. So I'm going to flip this off now and save you room on your disc, and I'll flip it back on in a little while when there's more to show you. All right, so everything went great here. There's your graft. That purple that you see up there is just at the edge of the bone that we have up there in the top, so that's right where we want it. There's your graft. Crosses your knee real nicely. As we extend your knee, there's your knee fully straight. There's a hyperextension, and your graft's not touching in the roof. So I'm real happy with the position of your graft as well. So we're going to fix it and get you over to recovery here in just a minute. I'll flip this off, and we'll do the last little bit of work here, and then we'll be good to go.